Well, thank you all for joining us. I'd like to call to order this special meeting of the Boulder Valley School District Board of Education for August 4th, 2020. Laura, would you please call the roll?
Garcia.
Here.
Gebhardt.
Here.
Marquis.
Here.
Myers.
Here.
Sargent.
Here.
Sweeney Moran.
Here.
Zis.
Here.
Thank you. So as you all know, the purpose of today's special meeting is to have an update on our reintroduction plans for the fall as we continue to adapt to the conditions around us and make sure that we provide safety for our community, our families, and of course, still valuing the experience of all of our students. We do appreciate those who are joining us live, but there'll also be a recording of this on the BVSD website for those of you who miss it or you have friends who miss it. And also, I just want to apologize. I've had various internet connection issues today, so if I drop off, I will be one of the people watching the videos. It seems to be going well for now, though, and then Kathy will take over. And so the format today is Rob and his staff are going to provide an update. We also have some guests here, Jeff Zayak from Boulder County Public Health, Dr. Urbina. I don't know who else is here. And then we'll have time for Q&A again. Anything else, Rob? Sound good?
Sounds great. Thanks, Board President Marquis, board members, Dr. Urbina and Jeff Zayak from Boulder County Public Health. Thank you for joining us as well today. We have an update for the community and for the board in regards to reintroduction today. Again, 2 weeks ago when we met, we said we would come back in 2 more weeks to see how things had shifted or changed and adjust any recommendations we made at that point accordingly. And I'm going to have to, Randy, I wish there's a better way to do this, but if I'll just tell you to move slides and then that's probably the best way to do this. Again, hashtag back together BVSD. I know that the past several months have been incredibly difficult for everybody as they've tried to stay with us as we've figured out not only a novel virus, coronavirus, but also how the logistical challenges that we face as a school system come into play as we plan on how we come back together. As a reminder to the board and the public, we have set out on the outset, we determined 4 different priorities regardless of the phase and tried to build a plan that would meet these, ensuring the health, well-being, and safety of all students and staff, maximizing student achievement growth and student academic growth and achievement, providing supports to our teachers and our staff, and making sure that anything we do is operationally and financially viable as we move forward. So board members, this is a review for you. For those who are just tuning in the public, these are the 5 phases that we built, spent thousands and thousands of hours. Our team, I'm very proud of the work that they have done over the course of these past few months in building what we felt like was a phase plan that would serve us well, regardless of the health information that might have come our way. And so these are the 5 phases, all the way from remote learning, remote via home learning, all the way to no restrictions and when we've eradicated COVID-19. So as a reminder to the board and the public, 2 weeks ago, we made a recommendation based on the health data and the information we had at the time to return in phase 3. Now, I will tell you one of the challenges that not only Boulder Valley schools, but every school district across the country is facing, and that is the shelf life of information is incredibly short, meaning the validity and reliability of information that you take to use to make any decision at any moment in time will definitely change in one way or the other. And so tonight, we're going to talk to you about our new recommendation, which will not be returning in phase 3. I believe the next slide, we are going to invite both Jeff Zayak, Executive Director of Boulder County Public Health, and Dr. Urbina to provide the community and to provide our board an update on how the health data has changed and some of the other factors related to health data, how that information has changed. I just want to again commend Boulder County Public Health. I couldn't imagine going through this without their partnership. It's certainly been incredibly difficult, but they've been great partners, have been very available. It's just been a really great partnership, and I've got just a great deal of respect for Jeff and Dr. Urbina. So with that, Jeff, I will turn it over to you.
Thanks so much, Dr. Anderson. Much appreciated, and thanks, board members, for having us back. I'm going to cover what our data looks like now, so you can see what our current trends look like. I'll talk about our capacity and where we're at, and then Dr. Urbina will talk about the new guidance that was released from CDPHE, as well as some of the new information that we're seeing on what we're seeing with children's spread relative to this disease. So, and Randy, do you have that slide, those slides? If you can go to the next one. Yep. So this is our current case loads right now. As you can see, we have been on a slow but steady increase in Boulder County. We are definitely seeing additional spread in our Latinx populations. We are in the process of expanding some testing, some mobile testing, to be able to reach our Latinx communities more effectively, as well as hiring a resource coordinator who can work with our Latinx population, because we know that's an area that's going to be important for us to support as we move forward. Next slide. This is just a reiteration of where we're seeing the largest number of cases. It is still in that 20 to 29 population. And in the last 2 weeks, we've seen increases in the 10 to 19, but also a little bit in the 30 to 39, with definitely the largest group in that population of 20 to 29. The only positive thing here is that these folks are less likely to have severe illness associated with this disease, but this is definitely the age group that we're going to need to continue to focus on, especially that 20 to 29 age group as we move forward. Next slide. This is our positivity rate. This has become a very big talking point across the United States, and without going into a lot of science behind this, the target for a positivity rate, which means that essentially you're testing enough people in the community to assure that you don't have virus spreading uncontrollably, is less than 5%. So if you drew a line at the 5% line, that is what the state target is, to maintain below 5% positivity rate in testing. And Boulder County is in a good spot in terms of positivity, which means we do have the ability to test more than we're testing right now. We're still working with the state in trying to make sure that we're getting quicker data returned, and that is part of a national problem and a state problem that they've been working on. So the turnaround time for samples is a big issue, and we're continuing to work on that, but our positivity rate remains low in Boulder County, certainly below 5%. And then I think that's my last slide. The other thing I want to mention that I didn't put a slide up there on is our hospitalizations. And our hospitalizations in the metro area are still remain fairly stable. We do have a slightly increasing trend in hospitalization. So I believe the latest data for Boulder County is we're up to 9. At our best, we were at 0 about a month ago. So we do have a slow increase in hospitalizations, but still well below any previous outbreak numbers that we've seen in Boulder County. And at this point, I'm going to go ahead and turn it over to Chris, who will talk again more about the latest guidance from CDPHE, as well as the data that we're seeing relative to spread in kids.
Thank you, Jeff, and thank you, Board of Education members. You know, it's a real privilege to be able to speak to you and appreciate Dr. Anderson's and his staff's perspective. I've always impressed with leadership who listens and uses science to make effective decisions, and I think you have a real winner in our superintendent here in Boulder Valley School District. So as he alluded to earlier, I'm going to talk about two things. I'm going to talk about the recent evidence as well as the guidelines. The guidelines are very detailed. I won't go into all the painful detail, but I'm going to cover the highlights of the guidelines. Just 2 weeks ago, we had a handful of studies on children and their spread. In fact, most of you remember we talked a little bit about the South Korea study that showed that kids over the age of 10 to 19 are very efficient spreaders, just like adults, and that kids less than 10 are not as efficient in spreading. And in both populations, both 1 to 10 as well as 10 to 19, when they do become symptomatic, they have mild symptoms. So we were largely reassured that with a low infection rate, as Jeff alluded to earlier, and having kids with mild symptoms, that we were okay with phase 3 and moving forward in that. Well, lo and behold, over the last 2 weeks, and part of this is because kids are going back to school in many areas, as well as kids are now getting together and not physically distancing anymore. We're finding out that there is some newer evidence that, and I'm going to talk a little bit about those studies now. JAMA just put out a earlier article that talked about viral load, and it's a preliminary research, but it's important to know that they've looked at a number of children and been able to demonstrate that kids even as young as 0 to 5 have still large amounts, as much as 10 to 100 times more viral particles in their upper respiratory system. What that means to us as health providers is that they potentially become a threat to spread the disease. Even though they're not infectious or viruses themselves, it's still the fact that they have a large viral load is suggestive that they could be potentially greater spreaders of disease than we originally had thought. And also, you all have seen the camp in Georgia, and it's got a lot of national attention, where they were not as good in terms of physical distancing and wearing masks. All the camp counselors did, but the kids were not as good as they could have been in terms of masking up, and also were staying in dorms together and sleeping overnight, that they found significant spread of the disease in young people in that population. And finally, the last study I wanted to talk about just briefly is an Italian study, and we have these references available. I think Dr. Anderson has them available if you'd like to look at them in more detail. But there's an Italian study that talks a little bit about the spread of disease in children just as capable as adults. So I'm going to stop there in terms of the evidence and just share with you that I think, and my suspicion, and I shared this with Jeff early on, is that as we have more kids coming out of their homes and interacting with each other and potentially in schools, that we're going to learn more and more as we go forward. And so I think that's important to acknowledge that we're learning as we go through this. The last thing I want to talk about briefly is the new guidelines, and they were just released last Friday, on July 30th. And I'm not going to go into painstakingly detail about them, but I'm going to cover the highlights. And what they basically help the schools do, and help us in local public health, is they help us define what infection spread in schools is all about. And as you know, in public health, we define, have two major definitions: a case definition, somebody who has been either tested or with a PCR test, or a probable case, may not have testing but have symptoms suggestive of COVID. Those are two important definitions that are outlined very carefully in the guidelines. And what that means is that we as public health, and you as school members and the school nurse and the principals and the superintendent, will be able to work closely with us in defining potentially spread within the school systems. And so these guidelines very painstakingly go through defining those populations, and then how we define suspected outbreaks as well as outbreaks. And a suspected outbreak is one in which you have a student, staff member, or a teacher in a cohort or in a classroom that has the infection. That's a suspected outbreak. If you have two or more of those definitions, that is two cases in a single cohort or a classroom, then that becomes an outbreak. And when we look out in the community, when we look at a business or a jail or a long-term care facility, that's how we define an outbreak: two or more cases. So we'd be using the same definitions that we would out in the community, with the schools defining those in the classroom or cohorts. When we talk about a school-wide outbreak, that is, not just in and the best example would be a long-term care facility. You have an outbreak there, but then you have lots of spread, which involves a significant populations of long-term care facility. And in this case, a significant spread when you have multiple classrooms, multiple cohorts that have either students, staff, or teachers involved. And then we would be talking to you about potential closures. And so that's all included in these guidelines. And finally, I want to say that we're going to be working very closely with you to monitor the outbreak and to monitor your population so that we can identify very early on these cases. And of course, our bread and butter is isolation of cases. That would be meaning that we would send these kids and teacher and or staff members home, and quarantine. If we have a significant outbreak, then we would quarantine that cohort or classroom, which means we would also send those people home. So I know that's a very brief description of what we do on a regular basis, but this is how it would apply to schools. And those are very painstakingly outlined in these guidelines that I just shared with you. So I'm going to stop there, and I'm sure there are lots of questions regarding this. But I wanted to commit to you, Dr. Anderson, and your staff, as well as the Board of Education members, that we'll be working very closely with you and our team of epidemiologists to make sure that we're watching this very carefully with you. I'll stop there.
Tina, I'm not sure if you're still with us. Your video is off. I didn't know at this point if the board wanted to ask any questions or if they wanted me to continue with the presentation. And then if Jeff and Dr. Urbina would be willing, they could hang on till the end and then maybe ask questions at the end, to pleasure of the board, whatever you all would like to do.
I think it might help for you to finish your presentation so we can ask our questions in that context. Is everyone okay with that? Okay, great.
Excellent. Randy, if you could pull up the deck then. So board members, as I shared with you all 2 weeks ago, that there are several pieces of data. I think that, Jeff Zayak and Dr. Urbina talked a little bit about the health data, some emerging studies, potential uptick in cases. I think there's two other pieces of information that are really critical that will allow us to move into phase 3. And both of these next two data points have really created a situation where we don't feel we can move forward in phase 3 at this point. We've really tried to work with our community and families around giving them some choice and giving every parent in this community a choice on what they wanted for their students. And whether that was in person in a hybrid or home learning for the whole semester. And those were the three choices. And we received data back. We tried to do a validation of that data last week. But I think that we have reason to question whether or not that data will hold up. We heard from hundreds and hundreds of parents who told us that they really weren't ready to make any decision and that they would tell us something, but they reserve the right to change that decision, which is hard because logistically we have to really know and understand the number of students that we're serving, not only district-wide, but within each school. But we understand, right? This is a scary time that, parents want to make the best decisions they can for their kids. And so that data, while we have some data that we have validated, we feel like that there's a question in regards to the validity and reliability of that. And then in regards to employee exemption data, as I shared with the board last week, I don't think that it is, we cannot ask our employees that are at high risk or that live with someone at high risk to be able to come into work during this time. And so we openly invited our employees to file those exemptions. And I'll tell you that, I've had conversations with several who had to, and it was a very, very difficult decision for them. I don't want to put that lightly, but it is important for us to know and understand how many teachers we would have to be able to work out the logistics on phase 3. And what I will share with you is think about one huge puzzle in regards to the number of employees, teachers and staff that we'd have to be able to come to work. And then think of 56 different separate puzzles because you have to solve all of those from a logistical standpoint to be able to make any staffing plan run. And I'll tell you that we had several schools where almost all of our employees qualified for exemptions. And again, we asked, this wasn't a, do you want to not come to work? This was, give us a medical note proving that you are exemption. And we used the criteria under both safer at home, and that also is the same criteria in Protect Your Neighbor, the executive orders that were issued by the governor. And we found that not only were there school sites that we would really, really struggle to be able to solve in regards to having the right qualifications of teachers and employees, even if we started moving employees all throughout the district, and overall, the number of exemptions, which was a little around 300, made phase 3 impossible for us to move forward. So, given the fact of the employee exemption data, given the student opt-out data, which again we worry about the validity and reliability, and the emerging health data, and I don't want to underemphasize the challenge that school districts across the state have been put in when CDPHE waited till last Thursday to release this guidance. It's something we were begging for weeks, because we knew that could potentially be challenging for us. And with all of the things that we're trying to figure out, we were hoping to have that earlier, and we didn't, right? And so I think that puts districts across the state in a very, very difficult position. So our recommendation moving forward, Randy, if you move to the next slide, is to start in phase 1. I'm going to ask Margaret Crespo, Dr. Crespo, to give a little bit of context around where we are with phase 1, because as a reminder to the board, all of our phases were built really on the health data, right? And it did not necessarily take some of these new logistical challenges that we're speaking to into consideration, right? So you'll see there's a plus because it's not as restrictive as 1. And so I'll turn this over to Dr. Crespo, who will walk us through the recommendation of starting in phase 1, and then we will talk to you about next steps and how we've really worked incredibly hard over this summer to make sure that home learning is a much more effective and productive way of teaching than the emergency teaching we did when we had a week to prepare. We've done a lot of preparation, so I'm excited to have Dr. Crespo share with some of that with you at this point. Dr. Crespo.
Thank you, Dr. Anderson. Good evening, board. Just want to touch base on our 1+. So I'm going to go through this document, through this slide pretty slowly. We recognize that this is, as we've gone over the phases, there is a little bit more information. And I just want to take a second and tell our families, our parents, our communities, and our kids how grateful we are for them and having them alongside with us. We know that our staff has worked tirelessly this summer, receiving feedback and trying to build this to its full capacity. So as we look at phase 1, we need to recognize that all of our BVSD buildings will be closed and all learning will be conducted remotely. This indicates that there will be no physical environment, that transportation is suspended, there's no transportation. We will, however, continue to do meals who can attend childcare, and we will be doing emergency food distribution provided regionally as we have in the past. I want to let families of students with special needs know that we have a plan. Our special education department will be releasing by the end of this week information around individually contacting our families. We recognize that the individualization of each child is necessary for a specific contact. So please let us know if we can help or support, but that information will be coming in the next week or so. Students will be receiving their instruction remotely. We will be, as much as possible, providing childcare programs for infants, toddlers, preschoolers, elementary, and our K-8 students, because we recognize the need, and in many cases, we'll be able to provide that level of support. And that we will have limited high school athletics, and this is given by the guidance through CHASA. We'll be doing training and conditioning and following very tight health protocols, including the physical distancing and screening. I think it's really important right now to take a moment and just recognize that we understand that this information, when we think back to March 13th and how that launched, how grateful we were for our community sticking with us as we launched home learning in a way that, as Dr. Anderson mentioned, was truly in crisis. And we worked really hard to the best of what we had available in our resources, and our teachers worked diligently to launch what could be done. And one of the benefits of having the last several months to work on what we have and will be sharing here is that we heard our families. We heard our families, we heard our students, and we heard our community and teachers. And we had surveys and feedback about what worked and what didn't work. And I'd like to share over the next couple of minutes really how we've improved, not just in a very philosophical way, but with some very specific resource connections, and with hope that people will continue to provide us feedback moving forward. And we're going to share where we're headed. We recognize that the importance of the survey results and the feedback that we've given really launched our work very honestly in an innovative way to meet the needs of our students, no matter what phase we were in. So although looking at phase 1 now puts us back in home learning, by no means do I want, or does our team want our community to feel that in any way this is not going to be less than stellar. Boulder Valley School District is an incredible district, and we always meet the needs of our students, and certainly we will continue to do that moving forward. Next slide. Okay, so let's launch into our improvements. So many of you listening in are familiar with our strategic plan. We continue to work through our strategic plan alignment, specifically related to our standards, our unit development, and our presentation of materials. I want to take a minute and thank everyone who worked on those unit design protocols and those systems. They are robust resources for our teachers to be able to, having prioritized the standards, teachers will be able to focus on those standards that are important for the success of their students. And they are in a system that is organized and simplified. So when we look at the platforms, much of what the feedback that we received in the spring was specifically related to the difficulty of navigating multiple platforms and having it be very complicated for the parents and for the student. And we spent a significant amount of time realigning what that system would look like to provide opportunities for our community, teachers, staff, and students to really be able to navigate that. We've set enhanced expectations around engagement and support, and that looks like teacher-student interaction that is aligned throughout the district, opportunities for both synchronous learning and small group and individual check-ins. We've provided systems for consistency, things that families can expect with a level of weekly consistency. There are schedules that we have determined appropriate for screen time, as well as independent learning, understanding that there has to be flexibility because not all of our students function in the same exact way, and we want to make sure that they have the best opportunities possible. We've enhanced our communication, not only the expectations around communication, as well as the systems for communicating. And we want to make sure that our families recognize that anything they need, we certainly are here and will continue to support our students moving forward. I'll also add that our materials and resources are new and improved as well. We've had a number of teachers, as I mentioned at the last board meeting, a number of our teachers really looking and aligning videos and resources that would assist our teachers in moving forward in a both synchronous and asynchronous way so that our teachers are connecting with their kids. And lastly, we've enhanced our professional learning and technology for teachers and leaders. And I'll explain a little bit more about that. Over this summer, we're very grateful that moving to a week later start date allows for our teachers to engage in a deep professional learning opportunity around what does it mean to teach online. You know, we have the benefit of having an incredible online school. Boulder Universal is recognized for its excellence, and those teachers and staff and our professional learning department is able to align those practices to bring a better, deeper understanding for our staff and our students. And then around that, our technology. We recognize that our technology had needed resources and technology needed updating, and we've been able to provide that for our teachers as well as our leaders. And we will continue to have professional learning opportunities throughout the year as we move forward, recognizing that we can capitalize on a catastrophe, frankly, through a pandemic, and make it the best and most robust opportunity for our students. Next slide. Here, I'm going to share quickly this video, which should be starting. I don't know if there's volume, but I'll talk through it. So this is an example Okay, so this is an example of one of our incredible videos that our teachers worked on this summer so that students can connect to foundations. As an example, these lessons, that was just a snippet of videos that are accessible on our resource bank. So our teachers will be able to access those as well. And then I want to share again that we absolutely heard our families and our communities. And I thought it was important with our team to develop, what is it that we did? We've been asked for a lot of specificity. So here are a few minutes to just highlight what are the changes that we've made. So in the spring of 2020, when we were launching, we heard that teachers had to use different platforms and that parents were having a really hard time navigating all of that as this crisis was emerging. And we took that survey data and we developed the following. So in PK3, all of our students all will use Seesaw as an interactive platform. It is a much better platform for our young learners. And for grades 4 through 12, our students will be using Schoology. Now, when we talk about using Schoology, I want to make sure that everybody understands that systemically, internally, many of our teachers use Google Classroom. And the benefit of Schoology is that the teachers will be able to load that Google Classroom component directly into Schoology. So forward facing, the parent would be engaging in Schoology, and the teacher would be able to link their work in their Google platform, as long as the forward facing is Schoology for ease of parents. And I'll share in a minute, we will be providing examples of support and videos, which we've mentioned in previous meetings. In terms of engagement, students did their work when they were able to. And we recognized that at the time, the level of crisis was so key to giving flexibility to families. And now from that feedback, we realize the importance, as this becomes the daily schedule of what students will be doing throughout the year to keep them connected and engaged. We want to make sure that it looks like a typical school day, and that our students will be receiving a daily opportunity for live support from a staff member. And we want to make sure that that is available for all students. And if there are concerns or if there are things that come up with connectivity, we will continue to work hard to assist families with that as well. The last couple are related to teacher interaction, just the number of touches that maybe a teacher had via video or Google Classroom, Google Meets. And I just wanted to make sure that we are articulating that it will be daily. Our students will have daily interactions with their teachers within their school schedule, and we'll be following a school schedule. Our lessons will be not doing regular assignments and based on previous learning, but launching new and exciting learning for our students through recorded lessons, live lessons, small group instruction, and new content and grade level standards, as I mentioned before, that have been prioritized and aligned to those unit lesson plans and unit systems aligned to our strategic plan work. In elementary school, students weren't given grades, and in secondary, we recognized there was a lack of consistency. And that survey results led us to making sure that there's a consistent grading level at each school. Pass fail will be only used in an individual basis in accordance with board policy. And lastly, we heard overwhelmingly from students and parents that they may not know what to expect from day to day. And of course, we were in a situation where we were moving forward very quickly and trying to innovate as we went on. We've had time to develop what it looks like for a student to have a consistent schedule and to receive a weekly plan from their teachers. And we want to make sure that the importance of learning and knowing what's coming is key to the success of our students in this online virtual environment. So before this video comes up, I want to just share with you, I cannot even share the excitement about having the following video come up. One of the things we heard from you, and this is directly to parents and students, was, I don't understand sometimes how to get on something. It's very hard to navigate how to start to get onto a website or to figure something out, and I really need help. And I just want to thank our professional development learning department. They spent a lot of time on the following video, and there's a series, there'll be a library of videos in both English and Spanish. The one, If the Volume Works, that you'll hear right now is in Spanish, just a snippet of the kind of innovation that we're working on so that our parents can come alongside as partners, because we know that our parents and our community are key to the success of our students' learning, and we look forward to working together with them. Randy? So that video would play as an example in Spanish. It's a voiceover of how to get onto our website and what that looks like to connect, and the panel of learning platforms that would be available to our families. So we'll give it just a few more seconds. So you can see as an example of what that would look like on the course dashboard. And it walks the family through how to connect, how to make that work, and who to call. Because what we have definitely made sure we want families to know is that we don't want you to send an email to an abyss. We want our families to connect, and that BVSD contact number for the service desk will give you help around what your students are doing in their learning. So please know that we are here to support. Before I hand it over, I'm going to hand it over to Renee Williams, who's going to share a little bit around our childcare moving forward. I want to just let families know how much we are grateful for all of you staying with us, our teachers, our community, staying with BVSD. We will continue to bring you the best experience. We will continue to work hard to meet the needs of our community. And please know that our kids are number one. Thank you. And with that, Renee Williams, if you want to.
Good afternoon. Oh, are you ready?
Well, I was going to introduce you. For those who don't know, Renee Williams is our Director of Community Schools. And for those that were unaware, during this entire pandemic, since I believe April, our team has been providing emergency childcare for our first responders and our essential workers. We've done that incredibly successfully. And so as we think about being in phase one, I will tell you, I feel just this incredible sense of responsibility as superintendent and for us as a school district to be there for our community and making sure that for those that have to go back to work, that they have a viable option and they can turn to us and we can be there for them. And while we aren't going to be able to start in phase three, and I know many of our families were counting on that, and if they're watching or as soon as they hear this, they are going to be panicked as a kid who grew up in a home where both parents worked, and as for many years, my wife and I were working parents together trying to raise young kids. I understand the stress that can provide for our families. And so we are going to be here for you. And we have not only a long-standing record of being able to provide excellent childcare, we've already been doing it during this pandemic. And so with that, I want to introduce Renee Williams, who will talk to you all a little bit more about the plan that we have moving forward and how we're going to be able to actually provide care for our families. So.
Thanks, Dr. Anderson. Randy, can you? Thanks. Okay, so as Dr. Anderson said, I am the Director of Community Schools. And I think if you get anything else from this, I'm also, as a former principal, as a former teacher, and I'm a mom with 2 kids in this school district. So I understand deeply how important it is to find a safe space for your children. I also understand people need to work. I grew up really poor. And my parents had to work, and so we relied on childcare. I was a kid in childcare all the time and passed from neighbor to neighbor, and so I get those competing needs, and so does our team in community schools. And so the many things that community schools does, including lifelong learning and facility use and all those great things, we also do childcare. And as Dr. Anderson said, we've provided childcare throughout the pandemic. In safe at home in all the phases of public health orders, and we've had so far 0 COVID cases with children under our care. So we believe that we can do this. We believe that we can do this safely, and we believe that we can do this at a low cost to our families. So what we're proposing is to offer 5 days a week, 10 hours a day of childcare for kids at every K-5, just about every K-5, K-8 school from 7:30 to 5:30 p.m. We also are proposing to offer childcare at select elementary schools. So for families that already receive childcare through Color Me Smart program that's under community schools, those childcare programs will run 7:30 to 5:30 Monday through Friday. We are also proposing to have infant and toddler care at our Early Connection Center at Arapahoe Ridge High School from 7 a.m. to 5:30. And it's a separate site within Arapahoe Ridge with a secure entry in and out. And we just, those are our hours. So we're just going to keep them. And then one of the things that I know folks will have questions about is, you know, what do these childcare programs look like? And one of the things I want everyone to know is that we are licensed by Colorado Department of Human Services, Boulder County Public Health, and we work daily with childcare licensing experts throughout the state. So there, we have really strict and tight guidance, and it's actually really clear, unlike a lot of other things that school districts have to navigate. Childcare licensing is really clear. And we have a handbook, and we have created the handbook in the spring, and we're in the process of updating it for the fall. So I feel really good about our ability to provide safe care. Within our childcare programs, there'll be a safe place and a quiet place for kids to work on schoolwork. And our childcare professionals will provide that support during the day. They are not teachers, but they are highly skilled and highly trained. And just like if your child already goes to a before or after school care program and they get homework help, they would just get it all day long. And then we also are encouraging children to bring their own devices. We have additional devices available for those who are in need. And of course, we have high-speed internet at all sites. You got the next slide, Randy. Okay. So one of the things that Dr. Anderson worked really hard, and Bill and our whole team, is to make sure that we have affordable childcare. And so our rates for K-8 childcare are greatly reduced and below market rates and below our normal rates. And so we are proposing $40 a day for children. And that's again from 7:30 to 5:30, Monday through Friday. Full-time childcare for preschoolers is $65 a day. Full-time childcare for infants and toddlers, $89 for infants and $86 for toddlers. You will look at those numbers and probably wonder, well, why are infants and toddlers and preschoolers more? And again, it goes to our state licensing requirements. So we have a much lower staffing ratio for infants and toddlers. And the staff for infants, toddlers, and preschoolers are required to have additional training. So it simply costs more to provide that. So that's why those rates are a little bit higher. We will work with every single family who needs assistance. We understand people have lost jobs. We understand the uncertainty that this pandemic has posed for all of us. And we will not turn your kid away. We will work with you. We ask that you work with us. But for students who qualify for free and reduced lunch under the National School Lunch Program, there's a separate application for childcare, and it's called CCAP for short, but it's the Child Care Assistance Program. And we will work, we have a person on staff that works with families to get those applications in. And we will have a scholarship and waiver process for families with financial hardships. Okay, go to the next slide, Randy. Thanks. Knowing that we've made a commitment to provide childcare at just about every K-8 school and many preschool sites throughout our district, we also need staff, because our staff, we are BVSD just like everybody else, and we do have quite a number of staff who have received exemptions, and so we're hiring. So if you do know someone, this is my little pitch, if you do know someone who loves working with kids and needs a job, and please encourage them to apply. It's right on the jobs website for BVSD. And I think we're right now looking at hiring 83 people, and we provide great benefits and a great working environment. And truly, our community schools childcare team is phenomenal, highly experienced, highly skilled. They will make everything work when you ask them. And if they don't, they come up with really creative solutions. So it's a fantastic team and a great working environment. That's all for me.
Thank you, Renee. Again, thank you so much, Renee, to you and your team, for those that have been working all throughout this pandemic, for being there for our community. And I just can't thank you all enough. I get asked very often, what can we do to help? If you love kids,
We got a job for you.
There's a great opportunity to join our team. And so we can be there for our community in what I know is a very difficult time. And I also realize that just, a few weeks is really tough to try to figure out what to do. Let us try to help you first, families that are out there. Let us please do that. Thank you so much, Renee. So next steps. Board members, as we think about phase one, and I appreciate Dr. Crespo's presentation, I do think that our online learning will be much improved. I think that we've gotten really great feedback from our community, so we'll be better able to meet their needs. But I think that we need to be working together to think about how we can move from phase one, when it's safe, to more in-person learning experiences with our teachers. And so, again, all of our phases were built only on health data. It didn't talk about some of the limitations, the logistical limitations that we would run into, which we have. And again, just for our community and for this board, any organization during this time that isn't willing to be nimble and shift and adjust is gonna fall behind pretty quickly. Luckily, we have a great team that I have a ton of confidence in. And so while we are having to move to phase one and phase three logistically will not work, I'm excited to begin to be partnering with not only with our employees, our teachers, our leaders, members of our community, to really begin to think about what phase 2+ could look like. And so I'm going to ask Sam Messier to present to you kind of where we are in the planning phases in regards to what will the next phase look like when the data allows us to go back. And so Sam, I'll turn it over to you.
Thank you, Dr. Anderson. And good afternoon, President Marquis, members of the board. As we move towards phase two, we're really excited to be working in partnership with BVEA to collaboratively develop a set of recommendations for the specific details of what an expansion into that phase two could look like across our district and across our various schools. As we begin this process of co-design with our teachers, parents, administrators, and staff, we'll be concentrating our efforts on first fully understanding and aligning with the Back Together BVSD priorities, which we've previously talked about, but also on fulfilling our commitment to equity by exploring how we can best meet the needs of our most vulnerable students, and also exploring different ways to engage our youngest students in the learning experiences that'll build a strong foundation for their long-term success. Next slide. We plan to assemble this committee by the end of this week and begin meeting on Tuesday of next week with a deep dive into the current health guidance and the details of the existing BVSD 5-phase reintroduction plan. We'll be using a design thinking process to engage the full committee in developing recommendations for the implementation of phase two. And we intend to present these recommendations to the board on September 22nd. Next slide. In the meantime, we've been reaching out to families within our community who are developing learning pods as an innovative way to support students and families during phases of reintroduction that involve home learning. We're embracing these learning pods as an opportunity to think differently about how we can serve students through a variety of models that may not look like our traditional image of school. We're looking to support the self-organized pods with resources, materials, and training on how to make sure that students develop mastery of state standards. In addition, we'll be exploring ways for students in pods to access opportunities for social interaction and academics within the parameters, of course, set by health guidelines. And we hope that we can enhance the experience of students in pods that are currently forming and keep those families connected to BVSD. At the same time, we want to be able to extend similar opportunities to students who are not currently in pods but might benefit. We're tremendously grateful for our community and their willingness to partner with us. Dr. Crespo has had some great conversations with the families that have been organizing pods, and we're excited to work more with them. And with that, I'll turn it back to you, Dr. Anderson.
Thanks, Sam. In closing, board members and community, again, these are tough times. I can't state that enough. These are complicated times. I think that you have my commitment, board, to continuously be honest with you, to react to the information again, and the shelf life of information is, maybe 1 or 2 weeks at this point, to continue to come back to you and share with you our recommendations and coming back together. I'd ask that our families stick with us. I know that this is difficult, but we want to be there for you in every way that we are able to be there with you. So again, just in closing, recommendation, phase 1 up till September 22nd. By that point, our phase 2 working group, which certainly includes teachers, but also we're hoping to include parents, members of our district accountability committee, and administrators, with the consultancy of experts in health and experts in other areas, to bring you a unified plan that we're all comfortable with moving forward, because we all want to be there for our kids. We truly do, and look forward to the day that we can. In the meantime, we're going to continue to fight and work hard to do everything we can to serve the needs of every student in Boulder Valley Schools. So with that, we will open the floor to questions. And Tina, however you want to moderate that, we're standing by ready to answer any questions.
Okay, thank you, Rob. And I personally just appreciate all this information and the inclusion of our Boulder County health partners, and also knowing that we're working with Broomfield Health. So, and I also appreciate that we recognize how conditions are changing around us and are responding appropriately. So for the question and answer, I thought we would again go in order, and if it's okay with everyone, I would start with Stacy and then go down the line, but we can go the other way too. Is everyone okay starting with Stacy? Okay, Stacy, why don't you kick us off?
Thank you. First, just a heartfelt thanks to everyone for all their hard work. I know it's not easy on all of you with the changing information, and the amount of work that's gone into all of this is really inspiring. And I also recognize that, the summer is a time when most of our educators rejuvenate. And so I, for one, appreciate the time you've taken to get us to this point. I have a couple questions. I'm still trying to absorb everything that we've heard, but I'll start with just a couple questions. One is, you mentioned a little bit about who is in the advisory group, and I just want to make sure that paras are included. We've heard from many paras in emails, and just want to make sure that their voices are heard as well.
I'll say this, yes, Stacy, certainly we want to hear voices. I've been very explicit with our team that we are putting together a problem-solving group, right? And so I know that there's lots of folks with tons of concerns. We all have concerns. The criteria for joining this group is thought partnership, problem solving, and we also have to limit the size of the group. You can't have a thought partnering problem solving group that's 100 people. That won't be very effective, and you won't be able to meet the tight timeline we're trying to meet, which is begin to start to really give us recommendations. So I see Sam has popped up. So Sam, do you want to add any more in regards to the involvement of folks within the group?
Yeah, I'll echo what Dr. Anderson said about wanting to keep the group small, but we do have a plan to do a survey of our other impacted employee groups, which would include the paras, and it would also include some of our other classified staff roles that work in school buildings, because certainly we want to hear from them about what their concerns are as we begin planning.
Great, thank you. My next questions are about remote learning and Boulder Universal. I'm wondering if those students who have already opted for Boulder Universal will be able to back out and go back to remote learning at their home school, since we are now starting with remote learning, and that may have been the reason that they went to Boulder Universal. And also, I don't know if anyone knows about how Boulder Universal might work with one's home school. I had heard that perhaps there may be some crossover, and I'm curious about that.
Before I let Dr. Prespo speak, I think that we try to be really careful in sharing with folks the difference between being online in your school and being at Boulder Universal. right? And I think that what we have to be careful about is people jumping to the conclusion, oh, we're online now. Because we're online now this moment. There may be a time, as data becomes clear, science becomes clear, lots of folks are going back to school, where it may be safe to bring kids back. And when that time comes, that's what our intention is going to be. And so, so Boulder Universal is really an online option for a semester commitment. In regards to switching back and forth, I'm not sure what our flexibility is in that. Again, I will tell you the logistical challenges around this have been just mind-boggling.
Yeah.
Dr. Crespo, I'll let you answer that.
I think you did a really great job answering. I would say that part of it too is that the specificity around the curriculum for each doesn't align like day to day. So if there's a family member or a family who feels like we want this online experience and we want this school connection, certainly what I would do is reach out to Boulder Universal and just talk through what that might look like. Boulder Universal is a comprehensive program. And to Dr. Anderson's point, moving back and forth will not be, that level of transition isn't available for a number of reasons. And for some families, the option for home learning might provide too many transitions for a child who's like, oh, we're in home learning, oh, we're back, oh, we're. So I think those are considerations that families would have to make. And then lastly, again, just the curriculum alignment is not tightly aligned where that back and forth would be available. It is a commitment.
Great, thank you. And then along with that, and I'm sure the answer is yes, but I'd ask it publicly. I know that Boulder Universal is an influx of students where they have not in the past. And I just want to make sure the appropriate resources and teachers and mentors are being funneled over to Boulder Universal so that they can support the influx of students.
Absolutely. We are meeting on a regular basis and are looking at all the numbers as they continue to come in and making sure that the allocation is absolutely appropriate for Boulder Universal. It really is a stellar school and we want to make sure that it remains that way. And that system of resourcing is key to make that successful.
Great. So I'll leave my questions at that. Like I said, I'm still trying to absorb everything that we've learned. So I might have another question later, but for now I'm good. And thanks again to all of you.
Okay. Lisa, I think you're next.
Thank you. Yeah, I'd like to start with a thanks as well. I know how hard everyone has been working. I hope the folks watching too know how hard Rob and the whole team have been working just almost around the clock for the last few months to try and stand this up. I'm wondering, is the county health still on the line? I'm curious if they could tell us whether or not they would recommend or allow for phase 3 now if we were able to stand it up.
I'm looking for them, Lisa.
I'm here. Chris.
There's Dr. Urbina. Very good.
So I don't know if Jeff's still on the line, but I'll do my best to speak for the health department. I think that we support Dr. Anderson and his team going forward. I think what we would be looking for is more evidence to look at any of the issues that we've talked about earlier in phase 3 about physical distancing, masking, hand and respiratory hygiene, in all large groups. If that evidence points us in the right direction that says that it's safer to go back to school, then we would be talking with Dr. Anderson and his team. And secondly, if our rate continues to stay low and goes down, boy, I think we could have that discussion again. So I think those combinations of things that continue to drop in the rate or infectivity rate, as well as newer evidence and science that says the recommendations are solid, then I think we'd like to revisit that.
I'm sorry, this is Jeff. I lost my mouse for a second, so I couldn't unmute myself or video myself. But I would concur with that. The only other thing that I would add is that we're going to keep a close eye, obviously, on the research with transmissivity in kids. So that's an important component that we'll continue to watch. I do want to add something I probably should have said earlier, which is this delay in waiting until the middle of September, end of September, is going to give us more chance to be able to watch those things. So I do think this is a good plan at this point, especially considering this newer data that we saw in the last week.
Sorry, Jeff, one more thing to add. I think we'll also know about influenza which I think will be very complicated in the fall. I think we'll be watching that very closely because obviously with the very strict guidelines that I recommended earlier, the challenge will be is how do we determine what kid has flu and what kid has, or what teacher, kid, and staff member has flu versus COVID-19. So that's also will be helpful.
Okay, thank you. I think when we hear about the improvements made to remote learning, that a lot of it sounds great, and that I'm really excited for how well this can work. I do think, though, there's a big difference between what we expect a high schooler to be able to accomplish and what I think, I think about my first grader starting this year, and I have no idea how remote learning is going to teach him to read or to write online, no matter how effective it is. And I have real worries about those littlest, our kindergartners and our first and our second, and whether remote learning can support them, especially if we're talking, I understand we're hoping to revisit this in September, but I think we all understand the possibility that we could be doing this for a period of 2 years, not 2 months. And what that means for our littlest is terrifying. So I don't know exactly what the question is, just that I'm concerned about it. And I think a lot of folks are, and I wonder what thoughts we have around that.
Lisa, I agree with your concerns. I think that it is why it is so incredibly important to make sure that we have great problem solvers and out-of-the-box thinkers on the work group that we develop to hopefully consider and know and understand the urgency, especially with our youngest leaders, our youngest learners. I'm sorry. When I think about when my kids were in kindergarten, first, second, third grade, or even myself, I would have never learned how to read if I didn't have a teacher helping me, and if I were in front of a computer. I don't know that it would have done it for me. So those things weigh heavy on my heart. Please know and understand that I want the board and the community to know that there are these competing pressures and priorities. And while we think that going right now to phase one is the right thing to do, it's not without regret for the opportunities that might be lost in the meantime for especially our youngest kids. So I have asked that our working group prioritize those students in K through 3, where we know what they learn is so critical for the rest of their success. And so I'm looking forward to watching them to develop solutions and ideas. And I think that there's a lot of wisdom in putting together a working group of folks that are practitioners that are in the field that know what's going on, and in addition to the parents who have kids who maybe home learning isn't working as well as it is for others. But my hope is by September 22nd, we will have some recommendations on how we can begin to start to, as soon as it's safe, sprinkle in those in-learning opportunities so that we're there for our kids. But I'm with you, Lisa, on this for sure.
Thank you, and I appreciate that advocacy for our littlest. I also have some questions maybe around what childcare would look like for them. I think 2 things I'm wondering. The first is, are we doing a cohort model there? So my kids will be with only a few kids and will be able to contain spread when they're going to school? Or is it more of a drop-in where they could be spending time with dozens of kids?
I can answer that. So we follow state child care licensing guidance. And right now, child care licensing providers across the state are allowed to operate at full capacity. Now, we don't feel that that's the right thing to do just yet. So what we are doing is limiting the capacity at every school to ensure that we have 36 square feet of social distancing, and following all the other guidance that you heard about in phase 3 that we will continue to follow with the childcare. To answer your question directly, K through 5 children are allowed to be in the same space for childcare. Again, we are limiting the capacity to ensure that there is adequate social distancing. We have great facilities and we're working to figure out some outside options, but by nature of childcare, they would be together. Having said that, we also have some pretty tight cohorting in place that we've been working with Boulder County Public Health on. So we're not going to take drop-in care, again, because we kind of mess with that cohort model that, is proven to be effective. All kids will wear masks, and we need to maintain stable staffing at every site. So we can't have a staff split between 2 different schools. And we had worked out some pretty tight guidance in the spring when we were at the most restrictive phase of our public health guidance. And so I'm confident that we can follow that. But yeah, parents will have to understand that if they're choosing childcare, that kids in multiple grades are mixed.
I guess my other question about childcare is I can picture what it means for a kid to have a stay-at-home parent who's helping them with their lessons. And I can definitely picture what it looks like too for some of these private pod units to have the amount of support that they're looking at. But when I'm going to work all day long, if I send my kids to schools, what kind of support is my first grader going to have from the people in his room when it comes to, especially for our littlest kids, they maybe know how to use a computer kind of, but not all the time. And then even just doing the lessons, my experience from the spring is it was something that required constant support and attention. So I'm wondering what that looks like if we imagine having, I don't know, what is it, 8 or 10 or 12 kids in a room and a child care provider who's trying to help 12 7-year-olds access a computer. What does that look like?
Well, we did do it in the spring, and it did work. They laid out a separate, so we take large spaces in the school, for example, and because we don't have school going on right now, we can kind of spread out. So the library, for example, the cafeteria, the gym are nice large spaces where our childcare staff during emergency childcare set up kind of centers, like a classroom that were socially distanced, and so that we would have a center for kids who are working on devices, and there would be a person there supporting them. Can they support them all day long? I wouldn't be telling you the truth if I said, yeah, from if you have your kid in there from 7:30 to 5:30, someone would be with your child that entire time. Someone will be in the room with your child and supporting them, making sure they log in, making sure that they're working with the teacher and grouping them. We don't group kindergartners with 5th graders if we don't have to. We can utilize some older students, but it would be a concern regardless of where a parent puts their children, right?
I appreciate that, and I know what a great job you're doing there, and I certainly don't mean to imply anything otherwise. Just that it's not what you're set up to do, to teach kids K-8 how to do all of their lessons. That's not what the job is meant to be. I don't think I have more questions. Yeah. I guess I'll just say that I feel concerned about what's clearly a big gap between what our working families are going to be able to expect and get out of this process, especially our working families with little kids, and the rest. And I know, Rob, how hard you've been working to try and get our kids what they need and how hard you continue to work. I'm feeling concerned.
I think those concerns are fair. And another hope, again, we wouldn't be proposing that childcare would be the solution, right? I think that in an emergency with 3 weeks before the start of the school year, we have to be there for our community, for our parents that are working where they would need somewhere for their kids to be, and they're going to be safe, and we're going to do a good job. That doesn't replace teaching. And I think that as we think about phase 2, and even beyond phase 2, additional supports that we can push into our childcare that are above and beyond what maybe we're able to stand up and share with folks what we can do today would be my hope. But we won't stop working, right? This is going to be, and to your earlier point, you're looking at a potentially a multi-year impact on our community. Settling in with the fact that we could be under these same types of situations with this virus spinning around this community for multiple years. We have to put our heads together. We have to think differently. If we can't bring kids to school, how do we bring school to kids? What are the things that we can do? I've got confidence in our team. I would say that we have that going for us. We have incredibly bright people who care so much about our kids and our community that I know they're going to work hard. And so I'm looking forward to the work within our working group, and just, again, the work that our team has done. I just can't say enough good things about how hard we've all been working, because we're not giving up. We're going to do everything we can to make sure that we support our kids.
Okay, Kitty? You're muted. Kitty, you're muted.
There. I have a few questions, but first I just want to say something to be on the record, and I put it on Facebook. And I just want to give a big shout out to Dr. Anderson and the administrators in BVSD. Over the course of a few months, they have had to create several scenarios for opening schools amidst a changing COVID-19 environment. All of these hardworking folks were doing this work on top of what they would have been doing otherwise. This has been a Herculean task which they have taken on with tenacity and grace. So now questions. They're not in any particular order. They're how I thought of them and wrote them down. Do we know, have we had any more positive tests from our athletes? Because I know we had one on a girls' basketball team.
I want to make sure, there's rules and laws around what medical information you can share publicly, right? So I just want to be very careful, and I'll ask Kathleen if she's on the line to just give us some guidance on what we can and can't share. I certainly want to be transparent, but I also need to respect, what we're sharing. So Kathleen, are you on the line?
Yeah, I'm here. So we can definitely talk about overall numbers. I just stay away from sites and actual activities. Yep.
Yeah.
Yep. And I don't have those total numbers, so I'm hoping.
I can speak in generalities. I know that we've had at least 2 instances with sports teams as folks have been training during the summer where individuals have either thought that they were positive or tested positive, and we followed health guidance, doing the appropriate quarantining, isolating. But I don't know, for those of you that saw, there was an incident in St. Vrain just last week. It was in the paper, the Daily Camera this morning. They started one of their jump start programs, and a weekend, I believe when somebody was diagnosed. But I think that, Kitty, this is how it'll be, right? We're in the midst of a pandemic. And so I think that health guidance is helping us. The quarantining and isolating is complicated, but it's a necessary step.
Well, I was just thinking about what's going on in baseball right now, and just wanted to be sure we were being a little more careful than they are. Okay. And how are we going to assess kids to see if they've fallen behind and how far? Are we going to do it the way it's always done? Is there going to be something different?
I'll turn to our academics team, and I'm not sure if Sam or Margaret, which one of you would like to give the specificity around this, and how we would roll that out in phase 1.
So I can jump in and Sam can share as we go forward. So certainly our best gauge of where our students are comes from our teaching staff and connecting with their history, the students' history and where they are and where they see themselves going aligned to what those standards look like. I know that our student support team, as well as our, the name is evading me right now, our other team, which Sam will say here in a minute, is working really hard to develop what those intervention components and extension components will be for students to make sure that they stay connected and engaged, and that those interventions are supplied in ways that are connected to the resources, curriculum, and instruction that we'll be doing. And I can hand over to Sam because I see her on there.
Yeah, thanks, Margaret. So, Kitty, to your question, I think that we have been working, we've had a team working all summer on what the whole suite of interventions might look like to support kids in multiple areas. With some of the CARES Act dollars, we're making some investments in some online systems that will provide additional academic supports to kids that are falling behind. There's a math program called Dreambox that we'll be purchasing for some of our students, which showed great success in our summer learning in promoting academic growth in mathematics. So we're really excited about that opportunity. But as we roll out some of the resources for teachers, some of these are instructional units that really help map out a series of lessons that teachers can implement over the course of several weeks. And embedded within that, we want to make sure that we're also providing guidance about how to differentiate for students who might be coming in at different levels of learning. And in addition, our student support team will be working on reaching out to those students who might have difficulty engaging with us for whatever reason. We're also trying to think about what supports we would be able to provide above and beyond the school day for those students who might be more significantly behind.
Thank you. And one thing I wanted to bring up, because we heard it from a few people, is people have said they've posted questions on the Let's Talk BVSD, but never see any answers. Where should they go for answers?
Well, I think that there are a lot of people that have had a lot of questions. I wish I could tell you that I was answering everybody's specific individual question the night that I received it. I will tell you that our team has been working trying to compile those individual questions and put those in with our frequently asked questions. I would say that now that our principals are back on contract, you know, one of the challenges, Kitty, is that a lot of people have very specific questions to their school site.
Right.
Some nuance. I mean, I can talk to you about the guidance. I can talk to you about high level, but my inbox, just like, you know, our board and lots of us have been inundated with folks demanding that we answer, you know, 15 questions that are at a level of specificity that we just haven't been able to fully answer to make folks feel comfortable. So with principals back on board, as we begin to really move towards what is a confident start to phase one, that's not going to change. There isn't anything that's going to change with that. We'll get better at being able to dial in and answer questions where the answers won't necessarily change, right? Like when people are looking for answers to questions, the other thing is, well, if the information that is related to the question that they're answering changes, then my answer would change. But I might not necessarily be able to reach back out to thousands of people and share those answers. So I will say that we're going to be in a better position to continue to answer questions at this point. We're continuing to work hard. I just ask folks to have to share some patience, right? I know that lots of people have lots of questions and they expect us to have all the answers. And you know, as information changes, I think that it becomes difficult to be able to meet the needs of everybody. So that's why we tried to bring them up at a higher level. And now that principals are back, certainly we'll be referring many of these parents back to their principals who will be giving guidance, and they'll be working locally with their teams to be able to give more specific answers.
Thanks. Yeah, I wasn't suggesting that you should spend the time it would take to answer every single question that we've gotten, because you wouldn't be able to do anything else. But
I tried.
I know.
I promise you, I tried. And we got to a place where we just felt like the best thing we could do to be honest and truthful and give answers that people could stand by is to try to bubble those up and do those at the FAQ level. Again, now with principals back, being able to refer parents back to principals on specificity, we'll be able to respond a lot quicker.
Yeah, thanks.
If you don't mind me mentioning, we have been taking that data and providing it with our leaders. So I don't want anybody to think that it's gone upon deaf ears. And we are planning on pivoting a little bit and having more answers into that tool as well. So thank you for bringing that up.
Good, thank you. And I hope that'll help those who are watching who have a lot of questions. One of the questions already got answered. In terms of childcare, how many CCAP slots do we have? And what do we do if they fill up?
We're just going to take the kids. We don't have like a set number. So we take, if we have an entire site and they're CCAP eligible, great, we're taking them. If there's a site, no one's CCAP eligible, we're still going to take them. We've never capped the number of children who receive or need CCAP from any of our childcare programs.
Good. I kind of thought you were doing that, but then I know you only get reimbursed for the CCAP, right?
Yeah, you know, what we're working with the federal government right now is that the time when kids are supposed to be in school during the day, right now we're not going to receive CCAP reimbursement for. So we will keep kind of pushing on that. But that's a federal decision. Regardless, we are going to take the kids and we are going to serve them and make sure that they have a safe space.
Okay, another question for Renee. In case I come across somebody looking for a job, what does it pay?
Well, it depends on what their qualifications are and which program they're in. I
Can you
think
give a range?
now, you know what? I'm sorry. I could get that to you. I will be happy to get that information to you, but off the top of my head, I don't know that.
Okay, that's good. Thanks. I'd appreciate that.
Of course.
And then the last thing I have written down is I'm wondering if kids, I don't know how to put this, if parents feel like their kids haven't done well enough by the end of the year, is there an opportunity for kids to repeat a grade if their parents wanted them to?
You know, I think, Kitty, in the long range planning, we're going to have to be able to be thinking about that. In addition, I think that, you know, over the course of the next several years, school districts across the country will have to be thinking about how to extend their school year, how to extend the school day, right? If we get on the other side of this, and whether it's 1 year, 2 years, 3 years, whatever that might be, you know, how do we try to catch those kids up before they leave us so they have the skills that they need? So can't answer that today. I would say that it's a fair question. You know, hopefully as we work towards providing better both online instruction and really strive towards getting folks in person, hopefully we won't have to answer that hard question a lot. But I can't answer it right now.
So I actually do have one more. So based on our staffing, is it true that we will never be able to get to phase 3 in this school year or not?
Well, so here's what I would share. The exemptions prevent us from running phase 3s in the ways that we had originally planned. So that's why we're going back to the drawing board in regards to what that might look like. We do have limitations in regards to exemptions, and regardless if we are in Safer at Home or Protect Your Neighbor, which again, as you saw the cases spiking, and as we see flu season heading our way, the ability for any community outside of a rural community with very small in and out of that community to be able to get into Protect Your Neighbor, I think it's just going to be pretty tough. We are going to be rethinking that. That's where phase 2+ comes in, where it tries to recoup some of the benefits of a phase 3. But at this point, unless the exemptions change or confidence from those that are exempted, that, you know, if somebody was exempting it because they're pregnant and they have their child and everything's okay and they want to come back, I think that there are some limitations on. There are reasons that folks would go from exempt to not exempt, but we can't ask that. Like we are going under the assumption that everybody who's exempt is going to be exempt, right? So phase 3 at this point, not viable. That doesn't mean phase 2+, 2.5, 2 3/4, whatever we're able to pull off. Again, we just are going to, and I am convinced all school districts will be going through this. I will tell you, board members, we've worked incredibly hard. I think that we are deeper into this problem than some of our other counterparts. And I attribute that just to the hard work of our team and just trying to be forward thinking. This is going to get a lot harder before it gets easier, and not just for Boulder Valley schools, but for every school district across the country who wants to open, but are figuring out that they can't.
Well, yes, there is another one more thing I thought of. Did you say St. Vrain announced they're going back 100% in person? And they're using the same health departments?
No. They made an announcement earlier today to their parents. I do not want to misstate what St. Vrain is doing. I would encourage anybody who wants to know what St. Vrain's doing to contact St. Vrain. I'm sure they have it on their website. They've published that out. If I said something prior to that alluded to something different, sorry, St. Vrain. That certainly wasn't my intent. I would refer anybody over to them to see what they were doing.
Okay, so I must have misread it. Okay, now I'm officially done.
I have Kitty, I have the answer to your question. If someone's interested in
Thank you.
working for us, our pay rates are anywhere between $13.50 to $22 per hour.
Okay. Thank you.
Welcome.
Okay.
And a great place to work. A really great place to work, Kitty. Just make sure you let them know that.
It's a great team. I love them.
Donna, do you have some questions?
I do. I'll start with maybe the easy ones because I had
people asking me to ask specific questions, and I will kind of, maybe Andrew or Sam can answer this question, maybe Margaret. But a lot of teachers have been confused with Zoom versus Google Meet. They want to be able to use Zoom. And one teacher specifically said that the ability to develop small groups on the spot, that Zoom has a feature where students can use their mouse to manipulate things on the screen. This would be really helpful with our Wilson intervention, as the students could be doing multisensory work where the teacher could see what they are doing currently. Students do that piece on their magnetic boards, then it's a juggling act for them to show the teacher. It also has many more interactive capabilities. Have we solved that problem with Google Meet or with Schoology? I understand that as I met with another teacher just today, when a student, and I know from having taught 30 years that when a student practices something wrong over and over, and I like the way the teacher said this, it fossilizes that habit. And if you're not there in person to catch it, there's a problem. So have we improved over the summer the Google Meet or the Schoology capabilities for that online component?
Yeah, I'll take that one, Donna. It's a great question. So Google is coming out with a number of enhancements that'll start rolling out this fall. They will not share the release dates yet, but they include the features that you're talking about, including polling, breakout rooms, the ability to raise your hand natively without a plugin, the grid view that will scroll, and Cabinet made the decision, I think it was last week, to actually fund the upgraded model. So as those features roll out, we'll get them automatically. We also looked into the pricing of Zoom. And Zoom still has its own challenges, one way more expensive than Meet, but also for whatever reason, Zoom will not sign the student data privacy pledge. And we're not quite sure why, but it still is one of those student issues. So Google is basically enhancing their product to bring in that new functionality.
So can I ask Andrew, have you checked into, because I know for confidential reasons, Ball Aerospace uses WebEx. Is that like over the top, too expensive?
Yeah, another great question. We actually spent pretty significant time looking at Microsoft Teams, WebEx, Zoom, and then the new features that will be coming in Google to make this decision. WebEx is more expensive yet, but the real problem with WebEx is that its user interface is not as intuitive. In all honesty, they were ahead of the game a decade ago, and these other vendors have passed them. And so when we were using it, we were running into usability issues with it. Not to mention that it really wasn't made for the educational world, where Zoom was, right? Zoom created those breakout rooms primarily for the university systems.
Okay, that's something that several teachers have asked me that know me personally and wanted me to ask, so I'm glad I asked it. They'll probably be sending you additional emails. And I have another question that this may go to Renee. A teacher asked me that if, as Renee said, kiddos would be using masks in this environment. So what about our special needs kids or kids that have issues? They're not going to use masks. I want to back up and say, Renee, I think you're doing excellent work. My son is attending a preschool, my grandson is attending a preschool all summer because they didn't want to lose their spot. And all the kids even use water spray bottles, practicing cleanup skills. And it's his favorite thing to do. But there hasn't been one breakout. There was one day he had a runny nose. They sent him home. He had a COVID test, and within 10 hours, that test came back negative. So they're doing every precaution. I'm sure that parents are going to want to know if we need 86 people to run these centers for our kids to be in. And so it seems like we're grouping kiddos together, and whether you want to talk essential, non-essential workers, whatever, we're doing something in person that that I'm hoping we can get to as a district sooner rather than later. I know that things change daily. I'm always surprised. I said, wait and see. It's like Ben Franklin said, only thing we know for certain, death and taxes. But I guess the question is what parents are going to ask, Rob, is if we can do these cohorts and we need 86, almost, they're not teachers, but the workers within these facilities managing all these kids. We're hoping, and I think it's your hope too, to go to in-person learning just like these kiddos are being in person.
Yeah, I would say that 83 teachers is it's a lot, right? We won't come close to the capacities that even at 50% in phase 3, and that we will have to cap certain sites based on the number of kids we can safely serve. You know, we built that 83 number on. We built it on the data that we had at the time, which was 830 families told us they needed that they were interested in childcare. Now that number may go up, may go down, Donna. I mean, you know, folks are going to figure this out the best way that they can. So it's if folks are going to ask the question, if you can provide childcare, why didn't you just open up schools? Again, logistically, I think those challenges around phase 3 with not having enough staff and the 57 different puzzles just became too overwhelming. We didn't have enough of pieces to move around. But we do feel like that we were going to be able to stand up childcares in ways that's safe, in ways that we've been doing all along. But at a, you know, if we're serving 800 kids and we're talking about 30,000 that we're tasked to serve, you know, just a minuscule amount actually.
And I get it. Thank you for the puzzle analogy. When you've got 56 puzzles and every puzzle has pieces missing, it's hard to finish anything. So thank you. And the last one, it may not be an answer. It may be specifically related, but several people have asked this question. People are weighing the option, especially our older and employees, my age and up, because they're contacting me and saying they're not sleeping at night due to trying to decide between furlough versus leave of absence versus going ahead and retiring. These are para questions as well as teacher and staff questions. And so as far as furlough versus leave of absence versus retiring, some people are saying, I'd like to do the furlough so that I can get my unemployment and have some kind of money coming in. There's been contradicting information saying that everybody will have a job. Maybe those people, some of those peers are interested in the daycare. My question is, who do they contact? Is it HR? Is it their principal to find out what's the best option for them?
Yeah, I think that anybody who's worrying about their future, calling HR is definitely the right first step. You know, I will share with you, Donna, because you mentioned furloughing. You know, we again are hoping that our parents and our kids stick by us through this, and we are willing to work in any ways that we can to continue to have our students stay enrolled. And we hope that they feel confident enough in our plan and understand that anywhere they might go is going to. There's nowhere that's COVID free or COVID safe, regardless of what they may share with you. We're all at the mercy of this pandemic, unfortunately. I will tell you that as we think about moving forward into next year, to talk about budget briefly for a moment, that a big part of our budget comes from our students. And we projected, board members, as you remember, as you approved our budget, we projected a loss of about 200 kids and built that into our budget. So if 200 kids show up less than showed up this year, our budget is spot on. For every 100 kids or for every 100 kids who either show up or don't show up, it's $1 million. Think of it in that simple math. So if we get 300 kids that we weren't expecting, we'll have $3 million more to be able to serve those kids. If we have 300 less kids, right now we won't need the resources. You know, it's not just a net. You know, it's you get $1 million or $3 million, or you lose $1 million or $3 million, because if the kids don't show up, you don't need the employees potentially to serve those kids, right? So it doesn't necessarily all hit your budget, but we will have to take some actions if that is the case. You know, if we if we see significant and substantial reductions in students for whatever reason, I mean, during a pandemic, people move, there's, all of our modeling doesn't consider pandemics. We don't have, enrollment modeling where that's built in. You could anywhere from 1% reduction in enrollment would be about 300 kids, about $3 million. And if we went up as high as 5%, you'd be talking at a $15 million difference in the budget that we shared with you all and you all approved versus the adjustments we would have to make and during a mid-year budget adjustment that we would bring to you all. I will say that there's certainly hope that there'll be more federal stimulus dollars that, certainly hopefully our governor and legislators are tuning in to this issue early so they know and understand that the fundings in schools, what's going to happen if students opt to not send their kids to public schools here or in other places. And so time will tell. I think that I will be able to give this board a clearer update in September because I'll know what our enrollment numbers look like. And that will probably be the first place where we can begin to start talking about what this might mean. If we have a $15 million hole to fill or even a $3 or $4 million hole to fill, board members, as you recall, we were able to use $10 million in one-time funds to be able to make it through last year, keep all of our employees whole. And we had been conservative in our budgeting, so we didn't spend all of the money that we had budgeted. We don't have that $10 million again this year. And so we would be faced with some pretty difficult decisions if that were the case. But a lot of time between here and there. And again, lots of other things that we're focusing and working on. Our hope is that our team is able to provide the services that serve our kids and our kids can stay with us.
Thanks, Rob. I just felt obligated to ask those questions because they come to me and it's kind of my job to put it toward to you. And I think the staff is doing incredible. I can't thank you guys enough. You're working around the clock. Last question. Do charter, I know that private schools get to follow whatever guidance they want and those are opening and overflowing at this moment. But the question I had from some parents and teachers, do charter schools in our district, are they following the same phases? That's the last question.
I would say that I think I don't know that every charter is communicated with their parents. Some charters choose to kind of join us as we make these big calls. Other charters decide to make their own judgments. I do not know at this point, and I believe this is a true statement, that there is a charter in our district that's planning to open 5 days a week, full board. It wouldn't follow the health guidance, right? They have to kind of follow the health guidance that we follow as a school district. So the only thing you could have had is school districts that were planning a more restrictive plan than the school district has. And so I would just encourage people to check in with their charters. I don't know exactly what everybody's doing, but I do believe that some type of majority of instruction in person, and then maybe some schools are able to do some, not in person, but online, and maybe some schools are able to do some part of in-person support. I just don't know the actual details on all of our charters.
Thanks, Rob. That's it.
Okay. Kathy.
I'll join my colleagues in saying thank you, Rob, and thank you, your team, for doing such an amazing job. And I know that it's been really challenging, so my heartfelt thanks to all of you. Some of my questions, Rob, you may not have the answers to since we're still trying to figure things out, but I'll just ask, and then, we have a couple of board meetings coming up that I have a couple questions about as well. So some of the concerns that we were getting was on the programming for middle school. And now that we're going remote, I'm wondering, what does the programming actually look like for middle school? Are they taking the same number of classes? Are they taking the same schedule that they would if they were in person? The hybrid schedule, is that going away? What does a middle school just structure look like?
Sure, and I'll let Dr. Crespo answer this, but and certainly we heard those concerns, right? Again, I think that when you're trying to meet multiple objectives, I think that some of the models that we had developed originally were developed around cohorting in mind, right? And cohorting getting really complicated and really nobody giving us specific details on how many numbers should be in a cohort or not, right? And so us trying to speculate, and then so in any event, I'll but I don't, that's not the case. We won't be following that model anymore. Dr. Crespo, if you'd like to answer.
Sure. So after the feedback we received the last conversation, we determined that what we really want to make sure is that students are able to transition from the home learning to school without being more overwhelmed, right? So we would be at this point following a 3-by-3, so that students would have their 3 classes in larger chunks of time with a thread of literacy and ongoing math support. So they will always have their core literacy and math, and then larger chunks of their content, so that they can continue to connect with all of their learning, just making sure that our focus is really on not overwhelming them through transitions in and out. So we have some mock schedules that we're working on that will allow for that consistency, and I can make sure that those are available and being launched right now. We're working on feedback from middle schools, but that's really kind of where we are.
Yeah, I think it'd be great to get a little more detail once it's ready to what the schedules are going to look like for middle. And I have the same question. Oh, wait, before I leave middle school, I know Chas is telling us what we can do for high school. We offer what I think is a wonderful middle school sports program. I'm assuming that's like not coming back. Is that a fair assumption? I love our middle school sports program.
Yeah, I would say at that point we are on hold with that, as we're listening for guidance from CHASA around high school and continuing to launch that.
That's what I figured, but I just wanted to, like Donna, I've had some questions from some middle school parents, like, what do I do? Because they were planning on these sports for their kids, and now they just want to know what to do. So the same question for high school. What is the schedule going to look like for high schoolers? Is it a block schedule like we were talking about with the hybrid? What is the high school scheduling right now going to look like?
Great question, Kathy. And for the same reason, we want to make sure that that system of transition is there. So we are doing a block schedule, 4 classes a day, essentially every other day, connected to our students. Some of our buildings have the flexibility to offer 3 classes with support in that 4th block, depending on where the student is in their high school career. So we'll be providing more information as we move forward. We know that the 9th grade transition year is really critical, and we want to make sure that our students are connected during that time as much as possible, and recognize that, you know, many of our students that maybe are involved in front range courses that are also online and other systems like that have the flexibility to be able to manage that commitment that we've made. So more to come on that, but definitely still following the block schedule 4x4.
And what are we doing for tech? Are they following the same? Because it seems to me that sometimes they require different kinds of, you know, in-person learning. And so how are we handling tech for this, at least for the foreseeable future?
So in many of our conversations with tech over the spring, we were able to do a number of lab kinds of opportunities and do the non-connected component during that time. And I would say that as we launch into the beginning of September, we will start that way. And then as we're able to think about phase 2 and what that might look like moving forward, the students would be able to come in for their hours, making sure that they're making those apprentice kinds of interactions and connecting with their partners. So it'll look a little bit different, but we still absolutely will be offering those programs for our students.
So one of the criticisms I heard during the spring was just a lack of consistency. It was very teacher-based, and so you had some teachers who had who didn't have kids at home, for example, and didn't have other commitments, who could provide a little more consistency in what they're doing. I'm wondering, how are we going to try to ensure better consistency? I'm not as worried at the elementary level, but in the middle and high school level, or how are we going to make sure that those learning objectives that you have out there are actually being consistently applied?
So one of the things that we're doing right now is gathering feedback. We've put together expectations for teachers, for parents. What is it that we need from everybody to make this work and be successful? And part of the slides indicated some of that communication on a regular basis, giving feedback in a timely manner, weekly connections so that families know what they'll be learning. And that right now has gone through our principal group and is currently in a teacher work group, kind of making sure that it makes sense and it's clear. And then we certainly will have we've alluded and certainly will have our DAC look at that documentation as well, so that we also wanted to have an ease of parental understanding. And we'll be pushing that out so that families know what we need and our teachers will be able to meet those expectations around communication and feedback and grading and attendance, and all of those pieces for connection. Now, we also are working on, thank you, our professional learning team. We are also working on a system so that if the teacher feels like they need assistance, or parents feel like they need more of a connection, we have ways of connecting parents and teachers, so that as I shared in the video, that little snippet, a parent who may need support can click into a video and get just in time kind of quick opportunity, like, how do I connect? What does that look like? Where am I communicating? And then conversely, we would see the same thing for our teachers. So we're working on not only the week-long virtual professional learning launch, but we also are working on systems of support, so that if a teacher were to say, I feel like I need support in this experience, we would say, great, you're going to sit side by side with a mentor connected to you, with you in your classroom virtually, making sure that you are getting the support that you need just in time. We certainly have had all of those supports in place along the way. We just want to make sure that we're making that transition from face-to-face to a virtual experience, and we'll be providing some details around what that looks like. And then I would say that we're hoping that our community and parents will continue to communicate with us so that we can meet their needs in terms of their systems of learning for their students. And we'll have communication loops for that to happen, and those are being developed right now.
And from the administrative viewpoint, how are they even going to think about evaluation, since we have this new system that was just approved by CDE? How are we giving feedback and doing that with our teachers? If we don't know the answer to that, I'm fine waiting. It's just something that I was curious about.
Right, so I'm sure the HR can jump in here as well, but I will share that on the teacher side, on the PL side, we also have started to build capacity with our leadership around what does it look like to evaluate, to observe, to support, to coach in a virtual environment. And that will be literally just starting those conversations and launching that as we're moving forward. And then I'll hand it over if Mike wants to jump on related specifically to evaluations.
Yes, Kathy, great question in the sense of the evaluation piece. The CDE has now come out with guidance that the measures of student learning, which we've worked so hard on, is actually being suspended at this point because there's no data to actually use for a rating on the MSL side. So what we'd like to do is still have some conversation with our committee. I think our committee is still wanting to do that. So we'll have something going on, but I think the whole thing that Margaret said around virtual observations and evaluation will be looked at and partnered with our BVEA to talk about what that looks like right now, based on the same standards that the L191 puts out.
So just another quick question. So how are we handling subs? I know it wasn't going to be a different issue with phase 3, but we're still going to need substitute teachers, right? So are they going to have access to the same learning and the same training, so that when, I'm assuming that we're going to have teachers online that are going to need substitute teaching. So how is that going to work?
So our plan in phase 3 was to actually assign substitutes to each building with cohorts. We still have that plan, that we will still assign to a building so that there's a substitute. And in the meantime, what the professional learning department will be doing, along with Melissa Riberty and our sub-coordinator, will be doing some training, online training, in case they do have to go in and step in and sub. So I think we're going to be, I don't know, I can't give you a guarantee if it worked, but I guess it would be possible. We do have a lot of us who are interested in this work. They want to come back to work. So we'll continue to kind of adjust that original plan that we had for phase 3 and now make it to a phase 1, where we still would assign a couple substitutes to each building, maybe 4 at the high school, 3 at the middle, 2 at the elementary.
I know that we're supposed to come up, Rob, with a new, maybe Kathleen knows the answer to this, a new way to take attendance. How are we going to take attendance and make sure our students are getting the hours that they need in? Because my understanding is CDE may not have much to say about the days we're in school, but they haven't relaxed the number of hours that are required for us. So do we need to change our policy around attendance? How are we taking attendance to make sure that our students are attending and are engaged?
It looks like Margaret has an answer that she's been working on with Kathleen. So either of them, I'm happy to let them take that.
Yeah, and Kathleen can certainly jump in. I know that our internal IC team has been working with Chris Brecht, who's program coordinator for this work, and they have been discussing how to align that with the teacher-student data link to make sure that the attendance is being uploaded appropriately through CDE. That work is being done on a weekly basis. We are on a weekly call with other assistant superintendents in the area, and often CDE, either one of the associate commissioners or one of the people associated with whatever topic, join the call, and they recognize the need to be flexible, understanding that a lot of it is in policy. So there is a recommendation, and Kathleen can jump in here, around what those resolutions might look like, but we actively will be taking attendance and building out reports that will look like that. That's kind of the operational component around it, and making sure that it's accurate and appropriate based on student interaction, engagement, and attendance. And then Kathleen, I don't know if you want to jump in around the policies.
Sure, I can. So I've reviewed the CDE guidance on this and also sat in on the CASB webinar. The recommendations right now are that we have a broad definition of educational process that we can use as part of the attendance and engagement calculation. This board did that in the first resolution that was adopted on COVID in the spring, but we're looking at that again with a plan to bring forward a recommendation to the board for action next week.
Okay, yeah, because I thought there was a timeline on getting the resolution passed by the board. So we'll see that next week.
Yes, that'll be on your next board agenda. Very candidly, I think our first resolution accomplishes what the recommendation is still, but it makes sense now that we do have more guidance to put a little more meat on the framework.
And then one last question, how are we handling SPED? I mean, for kids that need, I understand in the spring we were, it's going to look different now, but the high intensity needs in the SPED, can you just walk through what we're doing for those kids, please?
So I'm sure Robin Fernandez can jump in also. So our oversight, Dennis Rastatter has done a comprehensive job of addressing all of the special education components related to IEPs and hours of service, and making sure that we're meeting the diverse needs of students in a comprehensive plan. What we have recognized is that, as we all know, each individual student has their own specific needs, and we've made a commitment to reaching out to each of those families to make sure that the plan that we have in place works with families and where they are for our programming. So I don't know if Robin wants to jump in on the next phase, or Kathleen, but that's a high level overview of kind of where we are with special education. And again, ever evolving. We need to make sure that staff and students are being taken care of.
Yes, thank you, Dr. Crespo. So Dennis Rastatter, Executive Director for Special Education, and his team are working on developing approaches individualized in alignment with students' IEPs so that we can communicate with families and communicate with teachers and communicate with related service providers within the department and realm of special education in order to meet each individual student's needs. And they will be communicating individually with families to this end. And so families can expect to have individual communications, have department and also their teachers reaching out to them in order to develop a plan that is individualized based on each student's needs.
Guess we can follow up as we get this kind of further down the road. So those are, my final question is probably for Andrew. Will we continue to provide the kinds of IT support, what do we call it, IT Prime, where, when families need I love the name, but I'm assuming that's just going to continue so that the missing link in this is if you don't have a computer that works, you can't do anything. So are we just going to continue what we've been doing?
Yes, and we've been running IT Prime all summer for those staff and student members that have had issues with their Chromebook. In fact, today, one of the administrators on our team here had an issue, and we were able to get a new device out. So the answer is yes, and we have 2 vans. There'll be supply and demand challenges, I'm sure, but we'll do our best to keep ahead of it.
I think it's really creative. I like the whole thing. So thanks for making that work. Sorry, I had so many questions. Thanks, Rob. Thanks, Tina.
Okay, Richard?
I think Rob was raising his hand there.
I was raising my hand because my computer was the one that broke that Andrew and his team were able to replace in a couple of hours. It was incredibly impressive.
Well, I too then want to thank and echo all the thanks and accolades that the rest of the board members have given to the Department of Health and also to you, Rob, and the staff and the great work you guys have done. I have a few questions. I want to start with the one question that has not been answered that seems to be like it's always being asked by all the emails that we're getting, and that is, when is the Board of Education going to vote on the way that we're going to proceed? And I know that we have already voted on the phases and given the superintendent and his team the authority to go ahead and do what they need to do. But there's an impression out there that in the community that we need to vote, or at least that's the message that I'm getting in every email that I'm receiving or reading. Okay, so I just want to put that on the table because I think the people need to know that. That's one question, but let me get back to the early childhood education process. And how many slots, how many actual slots do we have through community schools that will be able to provide the service that we need for the families? Or how many do we have? What's the capacity?
Well, I think that, Richard, that all depends upon Renee's ability to staff up, right? I think that we are going to do everything we can to attempt to meet the need within our community. But just as we ran into logistical challenges in phase 3, I would hate to make a promise to this community on an actual number, but because I just don't know how many folks we're going to be able to bring on board. And so we encourage everybody to apply. We encourage folks who need us for us to, we will be there. But that number that's a floating number. I can't give you an exact hardcore number. We've got 50 slots. I mean, we're building, our plan right now is to build out for 800 slots. And so, but if we need to build a plan for 1,000 slots, we'll do that as well. And we'll do everything we can to be able to stand that up.
And the other question that I have, thanks a lot, Rob. The other question that I have is your infant toddler. Is the Arapahoe campus the only place that there's going to offer infant toddler support?
That's my understanding, Renee, if you want to expound on that a little bit.
Yeah, that's the only program in the district, and it's built to spec for the requirements for infant and toddler childcare. So we can serve 20 infants, 20 toddlers there.
So very, very limited. Okay. My third question is, Renee, what kind of bilingual services are you gearing up to be able to provide to some of the families and children that you're going to be receiving?
We actually have a bilingual specialist on staff. So all of our communication is translated into English and Spanish. And she works with families, Spanish-speaking families, to do any kind of translation that's needed, to support with help in terms of registration. And her name's Val Cordova.
But I'm thinking in terms of the actual sites, are you going to be able to staff your sites with bilingual educators?
I think Richard, to help Renee with this, because I don't think that Renee could do this alone. I think that it'll be incumbent upon the district to understand and know the number of bilingual students that have signed up for childcare, and then B, how do we come and provide those services? And that would be incumbent upon the district to be able to come in and push in and respond. I don't know that childcare has that capacity unless they get fortunate and they happen to hire bilingual childcare providers in the hiring process. But I would say that those supports would probably have to come from the district, and so we'd be working with district staff on doing that.
So then, in addition to the question that Kitty was asking around compensation, how soon will we learn, or can you tell us what the qualifications are going to be for these particular providers? Because you're going to be looking at different kinds of providers.
When I say provider, I mean individuals, not other providers. I'm sorry if that was confusing.
No, when I use the word provider, I mean people are actually providing the service, the individual.
Yes. So employees, right? So I believe that Renee does have that job description, and I'd ask Mike Grottos to pop up here magically on the screen if you wouldn't mind, and kind of speak a little bit to that.
So, Richard, we could, if we needed bilingual services within that program, we have people within the district, especially going to a phase 1 where we could actually provide that. Now, they wouldn't be licensed, but they would serve as an aid, as a translator for our children and our families who come in. This is something that we've been exploring with the HR team about people, and I think Donna alluded to earlier about our furlough. We could move people around that are bilingual. We have many people who are bilingual who would be willing to help with that.
Well, when you're looking at the 0 to 3 world or space in terms of childcare, it would require a different type of a certificate as opposed to the qualifications that our preschool teachers now need. So I think those are questions that I have if we want to make any referrals or recommendations to Renee in terms of hiring. But I think more importantly is we were talking about phase 3. We know phase 3 is not going to work because of the exempts. And it seems to me like that's probably one of the major reasons why it's not working is the exempts. And now that we're going to phase 1, all those exams are probably going to be able to work on phase 1, probably, right? They'll be working for phase 1.
Yes.
And then if you move to phase 2 plus, some of those exams are still going to be working because there's no in-person contacts at all. So that begs the question in terms of the family, the parent is going to have some kind of responsibility with all of this as it relates to the in-home learning or the remote learning or the synchronized learning or all of that we're talking about. And I know I've been asking what kind of support our families going to get. And I'm talking more about the low-income Latino families. What kind of support are they going to get to be able to be helpful to their children when they're doing all of this remotely? That's one question. The other question is, as we're moving into the phase 2 plus advisory group, I didn't hear any mention in terms of the potential community partners that are out there that could be very, very helpful to that advisory group in coming up with some solutions. Because if we're going through the design thinking process, that's going to take time, and you can't do it with 100 people, like Rob was saying. It's going to take a smaller group of folks, or maybe you could. So what role are these potential community partners going to have in this design learning process?
Well, I would say great questions, Richard. First and foremost, I know that we'll be reaching out to have representatives from our Latino Parent Advisory Council on the actual committee working group. And so that would be one portion of representation. And I believe, and if Sam wants to pop in, I know that some of this is evolving, that as we create our timelines, that there will be the opportunity for consultancy. So think about, you have a group of people making decisions, but they bring in consultants to share with them other thoughts and ideas. I will say that, Richard, to your point, I think that there is an incredible opportunity to be reaching out to potential partners as we think about supporting both the existing learning pods and those learning pods that have yet to be developed. And I think that the proposal that we're looking at right now, obviously this is evolving, takes some serious looks at how can we partner with other potential entities that are already existing within our community to be able to support pods of learning and support kids. And so those are things, I think those are great questions. I do think that there's a perspective that that I think this board knows I take incredibly seriously, that we have to be there for all of our kids. And especially as we think about this idea of learning pods, every kid, if that's good for some kids, that's good for all kids, and that we should be working to make sure that everybody has that type of opportunity. Sam, is there anything you want to add to what I said?
I think the only thing that I would add is that as we move into the design thinking process, the committee is intended to be small, with a core group of folks that are participating in that. But Rob is exactly right that as ideas emerge through the design thinking process, if there's an idea that appears fruitful that involves community partners, that's the point at which we would bring community partners in to be a part of that process with us. We're open to all ideas at this point. And one of the principles of design thinking is that when you start out, there are no bad ideas. You really open the door to out of the box thinking and asking people to really envision all kinds of creative solutions. So I imagine many of those solutions will probably involve opportunities for community partners. We just don't know what they'll be yet.
Well, I'm certainly hopeful that you're going to include community partners in the design thinking process from the get-go.
We do have several parents that will be involved on this committee. So we'll have folks from DAC, from DPC, from the Latino Parent Advisory Committee. At this point, we don't have explicit plans to have external community partners.
Well, that's what I mean. I'm sorry, Sam, but that's really what I meant in terms of external community partners. There's a number of community partners out there that work specifically with the Latino community. And they're nonprofits, and they would love to be in there and see what kind of support they could be to our district.
I think what we could do, Richard, is go back and think about, how can we make sure that the partners that are willing to stand up and help and think through this, right? I think that one of the things that as we've set this group up is just that, folks being thought partners, being open to different ideas. And so bringing some different minds, I think that we can work some of that out, to your suggestion.
Thank you. And then a question that I have in terms of the enrollment and the attendance, the school, because we're going to be going through phase 1 up until what, September, would you say, Rob, for September?
September 22nd. It's a Tuesday. It's a scheduled board meeting date. That's why we picked it. And it's a month away.
At that time, probably transition to phase 2 plus.
Here's what I think is a foolish thing to do. I think that anybody who is telling anybody, telling their community, making guarantees about we're going to do something in a month's worth of time. If board members, if we think about where we were a month ago and a month prior to that and a month prior to that, I would say that at that point, we will be able to present kind of what that thinking is, and we just have to review the data at that point in time. I'm still committed to working closely with Boulder County Public Health. I won't recommend anything that is against what they're seeing emerge in the data or any modeling or research that they're reviewing. So I just need to be really clear that while our team is working on this, I cannot make promises on what happens during that time. That we're going to if the data gets better, we'd hope to be able to come more in person. If the data says that it's not safe to do that, I disagree with anyone who's time dating anything without the information that they need to make the decision.
Well, I'm not time dating anything. I'm just asking to see if we have any kind of estimations, at least in terms of when transition. See, the problem that we've had all along, Rob, and I want to push back a little bit, is that nobody knows anything.
I disagree, Richard. I think a lot of people know are doing the best they can to understand this. But I would say that I think what's really incredibly difficult is for a family who's trying to prepare how to live in a pandemic, they count on a certain date and time that we're going to be able to do something. And again, I'm committed, and as the board is committed and approved our plan that really follows the data from health officials, if that data changes, we have to be able to be nimble. So I understand what you're saying. A lot of people want guarantees and understand exactly what's happening. And I think we're doing the very best that we can to be incredibly clear and honest and open in regards to that data. I just don't know that we can say on this certain date, the data will look like this, and this is what we'll do. I don't understand how we could do that.
Okay. So once school starts, how are we? And I think Kathy was talking about the enrollment, the attendance, and you were talking about we may lose 300, we may gain 300, whatever it was. How are we going to know? How, what's that enrollment count going to look like? And I know that we have to submit an enrollment count to the state, and what's that going to look like?
Well, I mean, I think that's one of the questions, one of the moving targets that, add to the level of uncertainty. My hope would be that our projections would be right on, that the folks within our community would stick with us, and that through attrition and other just declining enrollment because of other factors, that we would lose a couple of hundred kids. But again, in the modeling that Glenn Sirgru does, and he's an expert, and he's always very, very close. Modeling through a pandemic, it just creates more variables, right? So Richard, I'm not saying you could see an increase or decrease. What I will know is that by the 10th day of school, we should have a really good sense of where we're sitting and where we're at. I would say that traditionally, that 10th day of school, we don't veer much from that between that day and the October count in regards to that's when the state counts the number of kids we have and provides funding. I'll say another thing that's still unknown is how is the state going to do that, especially if everybody's online, right? And so I think there's a lot that we still need to learn. I would hope to have better information for you all September 22nd.
And my last question is going to be on the bilingual schools. How are they looking in terms of exemptions, and will they be able to, either whether on phase 1 or whatever phase we're going to end up at, be able to provide the services that they need to provide for their kiddos?
I think that some of our bilingual schools and others, again, it's 57 different puzzles, right? Our job right now is to figure out that puzzle and figure out how to provide those services. And if there's a number of exemptions at any one of those schools, how do we backfill those in-person learning spots with highly qualified teachers who have all the certifications that they would need in the event that we're going to stand that up? So I think that's one of the many challenges that we're trying to figure out as we move forward. Again, phase 2 plus, phase 2.5, whatever that may look like, we'll take those challenges into consideration.
Thank you.
Okay. I just have a couple of questions. The first is, there has been some interest in outdoor classrooms and outdoor learning possibilities. And these questions, I think, were more relevant when we were looking at phase 3. Do schools still have the latitude to have outdoor classrooms during phase 1? And do they have the latitude to have social get-togethers for the beginning of school, like getting small groups of kids together, having outdoor picnics and things like that?
Great question, Tina. I would say that as we begin to work with our principals, again, our principals are learning today that this is this is how we're moving forward. You'll have to think about those opportunities. Again, we don't want to, on one hand, to say that we can't open schools, right? And the data saying one thing, and then start to have gatherings that would compromise that. I do think that within the past several weeks, I know that our team, Rob Price, our Assistant Superintendent of Operational Services, and others, has been looking into what are some tent options, what are some ways that you could stand up, comfortable spaces for kids to be able to learn. To the extent that we're still there, I think it's just dependent on school by school. I would say that if schools are interested in that, they'll have to be working with our team and with the right guidance. And those were probably school by school decisions with encouragement and support from Rob's team. I don't know if Rob Price wants to add anything else that I may have forgotten or didn't include. Rob, you there?
Dr. Ed, you covered everything I would have said, so nothing else to add. Tina, we are looking at tents also for childcare sites. So we hope to have those stood up by August 26th.
Okay, and again, this goes sort of on the same theme. Pursuant to Kathy's question, I do hope there are ways that we can encourage physical activity with all of our kids, particularly those who are not registered in the sports programs that are active in our community already. Is there a way that we can think about offering outdoor playtime on our fields if the weather's good for our kids, and doing it whether it's free play or soccer, things like that, just so they get outside and play?
I think that those are great ideas. Again, once if it's determined that it's safe, and something I would hope that the phase 2 work group would consider moving forward. Again, getting kids to be active, getting kids to be outdoors and getting physical activity certainly aligns with the priorities of the district. Just making sure we work within the parameters that we have today, and as those parameters shift, whether they loosen or open up.
Okay, and then I have a question for Jeff Zayak, if he's still on the line.
I am.
Hi, Jeff. One of the things that's discouraging is that we obviously know we're in a pandemic and our numbers are going in the wrong direction. Do we feel that the community should be doing more to slow transmission so that we can accelerate our goal of getting back to in-person learning?
The answer to that is yes. I think the more we can do, the better off we're going to be. I do have a encouraging statistic from our mask survey. So we have, from our mask survey that we just did, upwards of 90% compliance, all the way up to almost 100% in many areas. So that is one thing that I want to thank anybody that's listening to this and they're wearing masks. You can wear a mask for sure. That will help prevent the spread of this disease. You can maintain social distancing of 6 feet and not gathering in large groups, and especially in closed spaces for long periods of time is going to be really important. It really does, as I think I said before, we can't be everywhere for everybody. So it really does come down to people's individual behavior. And if they maintain the social distancing, they wear masks, they wash their hands, then we're going to do better at preventing the spread of this disease. And we know we have certain populations that are out more and doing more of that. And we need to focus on those populations and make sure that we're supporting the message of why it's so important to do that and how it impacts everybody in our entire community.
Thank you. Kathy, did you have one last question?
Is that all right, Tina? It's a short one. It's on the theme of SPED, and I'm just trying to figure out, Rob, and maybe Kathleen or Margaret, what are we doing about our community-based program? Because I'm assuming that the community does not want our special ed students in the community, and how are we handling those students and those families?
Margaret or Robin, do you have the more specific detail on Kathy's question?
I can jump in, and then Robin, if she has more info. So our understanding is that as much as possible that our community allows for our students to come into those partnerships, we certainly will work with them. Again, following the same guidelines that are being undertaken by most of the community agencies and our typical partners. So that is still evolving. Our hope is that they will be able to connect, and we are trying. But again, it really just depends on the orders that are given and the safety of our students. And I see Robin is on there.
Perfect. Well said. That's exactly what I would have said. Thank you.
And I was just going to add that CDE is working right now on guidance for school districts specific to students with disabilities, discussing rolling out the development of contingency plans for our kids who are really impacted by remote instruction, or who are a part of a transition program or something else that would be more substantially disrupted by online. So I'm looking at some drafts. We do anticipate we'll have that and be able to be much more specific with our families very soon.
So all I would ask, Rob, is, I know it's early, is it maybe at the next board meeting or the one after that we just get an update on how we're helping those families? Because I just can't even imagine what the struggles are as they're learning this right now. So I understand we're working on it. So I'll just look forward to more updates. Thanks.
Absolutely. Thanks, Kathy.
Okay, so Richard?
just very quickly, and the same thing applies to the Latino family. Rob, if you can do that.
Okay.
Certainly.
All right. Kitty.
Can we get the slides from this presentation either sent to us or I guess put on board docs?
Yep, we'll post it.
First board meeting I've ever been to where there was nothing to read.
Yeah, we apologize for that, yes, and we'll make sure that we have that for you.
Great, thanks.
All right. So our next board meeting is August 11th. We don't know yet if we'll be in person or not. Regardless, we will not be in the boardroom because it's still under construction. So if it's in person, it will be at Platt Middle School, and we'll send out instructions about whether we would be able to have any kind of in-person public participation. We're not sure about that with the guidance of public health at this point. So I know that we'll keep having communication, and if we need another meeting, we'll schedule one because it does, well, I guess that's only a week away. Yeah, Donna? Is there
a place parents can go online or staff to or teachers to see CDPHE? Someone had pointed out that the whole document was online. Is it on our BVSD website?
If it's not, it'll be there within the hour.
Okay. All right. So with that, and obviously just keep sending questions and share your comments. I have read every email I've received. And if so, please do keep sending emails, send your thoughts and your concerns. And as board members, we keep emailing and talking with Rob. Rob, we appreciate your communication. It's been great. And it's very clear to me what we're facing. We're unclear. So yeah, go ahead, Rob.
One just last plea to our community. I know that many of our families are struggling right now. In our community, lots in our community and others, board members are going to start to experience something, unfortunately, I have a lot of experience with, which is situational poverty, and which is a different type of poverty than a generational poverty, when folks fall from either being a small business owner or in some type of a profession, to those professions not being able to be able to make money. That is a really, really, really tough place to be. I speak from personal experience. The hardest thing to do when you go from being middle class and living your best life to being thrown in a situation where you're not able to do that. The hardest thing to do is ask for help. And I would just ask and encourage anybody, especially around our childcare, if you need help, let us know. Let us be there for you. I would say that the model that we've adopted with the food distribution, where we don't ask questions, people just can come up and pick up the food that they need. I feel a strong obligation for us to make sure that we're here for our community, for both the community that we know has been at risk, and my biggest worry is we have a whole brand new group of people, parents, kids that need us more than they've ever needed us. So just from our school district, please know we're here for you. Please let us help you. And we know that that's hard, but I would just make that last plea, Tina, for folks that as they're fighting through the challenges that this pandemic as I know has brought to our community.
Okay. Thank you, Rob. And Jeff did make a notice that he's recommending that meetings stay remote. So I think for now we'll plan on the August 11th meeting being remote. All right. Unless you hear otherwise. Is that accurate, Rob? Yeah. Okay.
Yep. I just pulled that up. It is.
Okay. All right. So then I'd like to adjourn this meeting and look forward to speaking with all of you on August 11th. Stay safe and be well.